Hello everyone, I am Dr. Vinay Kumar, Consultant Orthopedics at Srikara Hospitals. Today I am going to talk about hip pain and its treatment. So what are the causes of hip pain? Generally patients develop hip pain when they injure their hip because of some slip or twisting injury, sports injuries, accidents or trauma. And most of the people post fracture also develop this avascular necrosis which is nothing but the reduced blood supply to the hip joint. So what is the parts of hip joint? Hip joint is made up of a ball-like structure from femur and a cup-like structure from the pelvis bone. So these two articulate and form hip joint, and this is covered by the labrum. So generally when you have hip pain because of any cause, you need to consult your doctor, and depending upon the area where you have pain, we diagnose your problem. Hip, to brief you, hip pain in the front might be because of osteoarthritis or the labral tear. Hip pain from the side of the thigh might be because of bursitis, trochanteric bursitis or inflamed bursa. From the posterior side might be because of some muscle inflammation or sciatica pain, or it might radiate because of some spine and sacroiliac joint issues. So when you come to us for hip pain, we check you clinically. Try to evaluate further with imaging of X-rays and MRI if needed. And once your problem is diagnosed, we advise you treatment. Most of the hip pains in the early stages are treated with rest, exercise and physiotherapy, and we prescribe some non-steroidal anti-inflammatory drugs that should take care of your hip pain. And let us talk about osteoarthritis of the hip. So what is osteoarthritis of the hip? Osteoarthritis of the hip is nothing but the degenerative changes in the hip. It might be because of age, which presents late, or it might be because of post-traumatic. Post-traumatic is some patients have fractures at their young age, then later stage they develop arthritis of the hip. Some patients, because of the the long chronic smokers or long-standing injuries and all, they tend to develop disrupt their blood supply. The blood supply to the femur bone is disrupted, and this head starts to change its shape. That is, it becomes avascular and gets necrosed. And because of this, you will be feeling the hip pain. So what are the treatment for osteoarthritis of the hip? If the osteoarthritis of the hip is treated or it is diagnosed earlier, in the early stage of the osteoarthritis, we tend to do is, we generally do core decompression of the hip. Core decompression is nothing but whatever area is involved because of the avascular necrosis, we make a hole on the side of the hip joint bone, we go inside and decompress the involved part. That might again give a chance for healing, and the circulation might develop again. You can save your hip without going for replacement when you attend it very early. If the stage of arthritis is late, like some people come very late stage of arthritis, so if in such a case we have to go for total hip replacement. Total hip replacement is nothing but changing your ball-like femur and covering your acetabulum. In this procedure, we remove this femur part which is avascular, which has become arthritic, and then we replace it with the artificial ball and stem. We put this stem into your femur bone, then we articulate it, we put the cup for the acetabulum, then articulate it back. So this is called as total hip replacement. The cup and ball are replaced. So after this total hip replacement, most of the people become pain free and they can get back to their lifestyle like before as soon as possible, within a week or 10 days. Okay, now we will discuss about the hip pain because of labral tear. Labrum is nothing but a capsule like structure which covers the hip joint. Sometimes when you are injured, like accidents or sports injuries, your labrum becomes torn, and this torn labrum causes hip pain. This labrum tear can be treated with arthroscopically, in which we make a small hole to the hip, and through the scope we go inside the hip joint, clean it, and we can suture the labrum back with anchors. So this can give good relief from pain. Also the impingement syndrome, cam impingement and pincer impingement, which is nothing but there is a growth at the femur head or pelvis, acetabulum, and this will cause impingement when you move your hip to a certain degrees of movement. Such kind of impingement problems and labrum tears can be addressed with arthroscopic or open procedures. So if you have such problems of hip like osteoarthritis, avascular necrosis, labral tear or bursitis or even impingements, please do contact us. Thank you.